So my name's Jonathan, Dr. St. George. I'm an emergency physician and a physician educator at Weill Cornell. And I work in the emergency department just across the river from Cornell Tech campus. And my interest has really been how we can apply design thinking to transform the learning space in medical education. I think many people have a lot of misconceptions about medical education. They think that it's all very high tech and that the latest and greatest is being used and it's very innovative. And I think actually, in fact, it's the opposite, that medicine is very slow to change. We're trapped in our own little academic worlds. People still give PowerPoint presentations. There's a lot of lectures. There's a lot of textbook reading and memorization. And I think there's been an increased desire to understand how we learn and to apply design thinking to that idea and to create sort of the next generation of learning tools that are really going to, meet learners where they live, to inspire them to want to learn more so that what they learn can help others. Because that's really at the heart of what we do as physicians, that we spend all these late night hours studying and learning because what we learn has the potential to help others. But in a world of accelerating and disruptive change, I think it's very, very hard for physicians and medical providers to keep up with all of that knowledge that's coming at them. And so instead of it being sort of inspirational and something that people want to do, it becomes this part of burnout and difficulty because we're constantly being told we have to do this maintenance of certification and we have to update this credential and this credential. And so my work has really been around trying to change that mentality and transform learning to be something that's engaging and inspiring and interactive, that reaches across boundaries to pull in arts and sciences, so that we can all work together to make learning something that sort of improves our ability to translate knowledge rapidly to the bedside. And so that's really been my area of interest. And particularly in the last couple of years, sort of looking at how the intersection between digital and physical space and how design thinking can really bring those together and bring different styles of learning together from diverse areas of knowledge and sort of weave them together for a more comprehensive, sort of holistic approach to learning.
No, I think that all makes so much sense because for people like us who do not interact with medical profession in this way, in collaborative way, this is first time for me. I'm sure other people, other designers have collaborated. But for me, it was really interesting when I met you and saw the way your approach towards medical education. It just opened up a lot of different ideas for me as a designer and a teacher. And and that's when I started thinking, and I think we have done some collaborations in past in small scale. And I'm excited to do this coming semester to kind of just even give another more push to really bring this interdisciplinary team and like help focus on all this idea of this intersection of making and health. And
Well, so for me, the area of interest that I took on, or at least the area within our program that I took on a leadership role in, was really teaching airway education, which is really all about managing people in acute respiratory distress who can't breathe on their own, and all the things that we do, all the tools we can bring to the bedside, all the ways that we can help a patient breathe when they can't breathe on their own. Things like using a bag valve mask, intubating, putting a breathing tube in, putting them on a ventilator to breathe for them, supplementing them with oxygen, all the things that we can do, surgical airways, so that when someone can't breathe through the upper part of their face, we can make an incision in the neck and breathe for them through that. These are all life-saving procedures that I've sort of become our group's expert on, and I teach to residents and physician assistants and nurses across from all departments from across the institution at a big airway course that I do. And so, as I've expanded my thinking about education and the learning space in medical education and what other disciplines can bring to that through design thinking. I certainly, that's sort of been my area of interest, and I would love to have a team of designers sort of look at that topic and imagine how we could improve the way that learners can pick up those skills so they can be more effective at the bedside when they need them. This application of design thinking is really about knowledge translation. How can we teach the next generation of learners to pick up the hand-eye coordination, the skills, the concepts, the tools, everything that they're going to need to be able to then apply it to a real-life patient? And that, that knowledge translation, that ability to get that knowledge to the bedside really depends on how we teach, not just what we teach.
That just makes me really hopeful for bringing really, exciting projects with this collaboration. So last year, in the spring, you gave my students a challenge, and it was, how might we improve the skills of physicians who need to perform the life-saving procedure of face mask ventilation by developing more effective teaching tool. And to kind of continue this tradition of the Skillshare videos we are doing, maybe you can show us some in that direction, a face mask ventilation, life-saving procedure. When we make to prototype, but when you make to save lives. So would you like to show us?
Happen to have one here. I'm not
Okay.
in our sim center, so I can't show you the actual procedure itself, but I'll try to demonstrate as best I can and give you a sense of, some of the things we're talking about. So this is a bag valve mask. This is the face mask here, and it goes over the face. I'm sure many of us have seen this. And then this bag here provides the oxygen, and there's a reservoir here at the bottom that connects to an oxygen supply, and then that goes through the bag and into the patient. Now, this skill, when you see it on TV, seems fairly straightforward, right? You just stick this thing on and just go like this, and it works. But there's actually a lot of fine motor skills and sort of real-time problem solving that goes on every time we use one of these. And I can show you on the mask itself where you can imagine some of the problems are. So this is the seal. And if a learner doesn't use their hands and doesn't grab it properly, that seal can be broken. And so then instead of the oxygen going into the patient, it kind of goes out the side. And the student or the learner doesn't realize that they're doing it wrong or incorrectly. And so there's no way for them to really get some feedback to show that that seal is correctly in place. Another thing is this bag, right? This bag is quite large, and you can squeeze really hard and push way too much air into a patient all at once. Or you can put too little in. And students, learners, when they start off, they really have a hard time gauging how much air is the right amount of air to go into a patient. And part of that is also there's no way to really give them a sense of, like, when you squeeze this, what's the pressure that is distributed into the lungs of the patient? They have no sense of that feel. It's something that takes quite a long time to learn clinically. And so this mask, one of the other things I would say is one that's challenging, that I think is an interesting challenge, is that when we do it on mannequins, these are these rubber latex mannequins, they're not really designed for teaching this. They have no feedback loop. They don't really tell you whether or not you're doing it correctly. They have little balloons sometimes that are fake lungs at the bottom, but those oftentimes they're not really designed to simulate actual lungs, so you don't know how well you're actually doing. And the other thing is, because they're rubber and latex, they don't simulate. What often happens with patients is when you push this down on someone's face, all of their soft tissues go back and occlude their airway. And we often have to pull up on their jaw at the same time to open up the airway and the breathing. And so to get the air into their lungs, because it kind of gets blocked off. And the mannequins don't teach you whether or not you're doing that right. So, when I think of design for a tool for teaching how to use this, right, I imagine not a simple rubber latex mannequin. Oh, by the way, those are like $1,000 to $2,000 when you try to buy one.
Ah.
And they're not really, they're meant for teaching intubation and other skills, but they're not really meant for teaching this skill, even though that's what everybody uses, because
Mhm.
nobody's ever put any thought into designing a better tool. So
Right.
if you could imagine a simple device that would allow you to put this over it
Mhm.
and lay it on there, and then uh, give feedback on whether or not the seal was placed correctly, how much pressure of volume of air was going into the lungs, and whether or not that airway was open or shut, depending on how well you did the chin lift. Uh, all of those things would give people real-time feedback that would rapidly enhance their ability to do this correctly. Uh,
Mhm. All right. Thank you. This was great.
cool.
So if you were to kind of give a challenge this year for our students, do you have something specific in mind you would um, like in continuation of what we have already done with you? And I'm hoping that's the student group who would, we can still give them the same challenge which we worked on last year and
Mhm.
build on it, because I think we had a good prototype which had a potential to work, and maybe we can develop that
Yeah.
into a real exhibition, or kind of like a prototype which we can actually do testing on. Um,
Uh,
and
sure. Yeah. So I think, building a some kind of model that teaches some of those basic problem solving skills that gives real-time feedback to learners about how well they're doing with this device um, would be an excellent. I think we started that prototype before COVID hit, and
Mhm,
everything got disrupted.
mhm,
And I think continuing that process of development would be very interesting. And I'd, of course, be very excited to kind of be the sort of physician expert to guide a team sort of working towards that development in all of
mhm,
its aspects. Uh, there are lots of other, we've worked together a few times. There are lots of other sort of hand-eye coordination skills like the that the bougie box that you created, which was this
mhm,
idea of being able to help people learn this fine motor skills of passing a little device down in between the vocal cords into the trachea so that you can deliver a
mhm,
breathing tube for them more easily, and that helping develop
mhm,
that skill.
mhm,
Um, those kind of devices sort of helping people understand the way the anatomy of the space of the neck and the airway is
mhm,
I think um, really helps physicians and medical students and residents understand the space they're working in. This is a three-dimensional
mhm,
space. It has angles, it has shape, and it has,
mhm.
once you learn how to work in it, like any environment, you get good at it. But there's not a
Right.
lot of tools available to do that. So, for example, when I was discussing earlier how if you press down too much, you close
Mhm,
off the airway because all the tissue goes in there. Uh, Being able to actually see what happens when you manipulate that space by, say, pulling up on the jaw or extending the neck or doing other things, to be able to
mhm,
see how that affects that space in real time and then change what you're doing. Those are all things that I think sort of fit into this challenge.
mhm.
And there are probably a number of different sort of paths anyone could take to sort of help develop those skills. Yeah, I think a great place to start would be, certainly from my perspective, is to sit down with a team
Mhm,
uh, who are interested in this type of challenge and sort of go over the anatomy and just
mhm.
understand the space that they're going to
Yes,
be
that would be
thinking
great.
about, and
That would
really
be
sort
great.
of give them a detailed discussion of it, and then take that sort of anatomic knowledge and then translate it into what the challenges are for real life doctors, where they struggle, like
Mhm,
where they fail and why and oftentimes we fail and we know why we fail, we just haven't figured out a way to get good enough at it to not fail.
mhm,
And so uh, giving them some of those sort of friction areas or high risk moments in airway
mhm,
management, and then and then using that as the jumping off point to kind of come up with this teaching tool. So, you
Yes.
know, if if placing the tube, if getting the tube all the way down to the chords is really easy, but people struggle to get it past the chords, how can you
Mhm.
create a teaching tool that might help people learn the 2 or 3 special moves that we always do, that the experts do, to be able to pass that tube more easily? So I think that's where those are the really high yield spots that a team who's interested in this project would kind of sort of start to dig into, and sort of maybe pick one or two of those, and go for it from a design perspective.
Right. All right. We'll call this a wrap for what I wanted to get out of this video.